Bismillahirrahmanirrahim. Assalamu alaikum, fourth year MBBS. It's Dr. Iqra Mushtaq. The topic of my tutorial is Baby Friendly Hospital Initiative and its 10 points, which we will study it in next slides. Right, as you can see, the Baby Friendly Hospital Initiative, it was launched by WHO and UNICEF in 1991. Following the Declaration of 1990. The initiative is a global effort to implement practices that protect, promote, and support breastfeeding. Okay, as you have heard the introduction of BFHI, to help in implementation of initiative, different tools and materials they were developed, field tested and provided, including a course for maternity staff, a self-appraisal tool, and an external assessment tool. Additional tools they were developed afterwards, such as monitoring and reassessment tools. After the launching of BFHI program, more than 152 countries around the world they are implementing this initiative. In this slide, we can see the objectives. What are the objectives of this initiative? First is to end the practice of distribution of free and low-cost supply breast milk substitutes, and to facilitate the hospital and maternity setup through the implication of these steps, 10 steps. Okay, as you can see, there's a comparison of colostrum and the mature milk. You must have known what is the colostrum. Colostrum, which is the milky liquid, which is not absolute milk. It is released in the beginning of 1 to 5 days at the start of the breastfeeding. There is a marked difference between the colostrum and the mature milk. The total number of the protein in the colostrum, they are high, like lactalbumin and lactoferrin, and especially the IgA, they are also high in the colostrum. So this is very important to counsel the mother about the importance of the colostrum. Okay, baby friendly hospital initiative, it consists of 10 steps to successful breastfeeding, which are as follow. Okay, as you can see, the first step of BFHI is hospitals should have a written breastfeeding policy, and the health worker, they should be aware of it on the daily basis. This written form, it should be in the most common languages understood by the patients and the staff, available to all the staff caring for the mother and the babies. They should be posted or displayed in the areas where mothers and babies they are cared for. And also we should know about the advantages of breastfeeding and the risks of artificial feeding, mechanism of lactation and suckling, and how to help the mothers initiate and sustain the breastfeeding. Okay, the second step of BFHI consists of to train all the healthcare staff in skills which are necessary to implement this policy. Okay, what to teach in the training, and what the trainers or the caring staff should know. They should know about the advantages of the breastfeeding. They should know about the risks of artificial feeding. They should know the mechanism of lactation and suckling, how to help the mothers initiate and sustain the breastfeeding, how to resolve the breastfeeding difficulties, how to assess a breastfeed, hospital breastfeeding policies and practices, and to focus on changing negative attitudes which set up the barriers. Okay, the third step of the baby friendly hospital initiative is that inform all the pregnant women about its benefits and management of the breastfeeding. How and what should they know? They should know benefits of the breastfeeding. They should know early initiation. They should know the importance of the rooming in, uh, importance of feeding on demand, importance of exclusive breastfeeding. They should know how to assure the enough breast milk, and the risks of artificial feeding and the use of the bottles and the pacifiers. Okay, the fourth step of BFHI is to help the mothers initiate the breastfeeding within 1/2 hour of the birth by placing the babies in skin to skin contact with their mothers immediately following the birth, and encourage the mothers to recognize when their babies they are ready to be breastfed, and offering the help if needed. And come to the another step, that is show mother how to breastfeed and maintain the lactation even if they should be separated from the infants. Okay, why is this early initiation of the breastfeeding is important? Because it increases the duration of breastfeeding. It allows the skin to skin contact for warmth and colonization of the baby with the maternal organisms, and provide the colostrum as the baby's first immunization takes advantage of the first hour of alertness, and babies they learn to suckle more effectively and improve developmental outcomes. Okay, how it can be happen? By keeping the mother and the baby together, by uh, placing baby on mother's chest, and let the baby start suckling when ready, and do not hurry or interrupt the process. Delay non-urgent medical routines for at least 1 hour. We move to the next step, that is the sixth step. Give newborn infants no food or drink other than breast milk, not even the sips of the water, unless medically indicated. Right, why the infants they shouldn't be given any other intake besides milk? Because decreased frequency or effectiveness of suckling, it will lead to the decreased amount of milk removed from the breast, and which will ultimately lead to delayed milk production or reduced milk supply. Now the seventh step is to practice the rooming in, that is allow the mothers and infants to remain together 24 hours a day. Okay, what is rooming in? Rooming in, as we have studied and learned in the earlier slide, it's a hospital arrangement where a mother-baby pair they stay in the same room day and night, allowing the unlimited contact between the mother and the infant. Okay, why rooming in? Because it reduces the cost, it requires the minimal equipment, it requires no additional personnel, it reduces the infection, it helps to establish and maintain the breastfeeding, and not lastly but not the least, it facilitates the bonding process. Okay, I have mentioned both two steps, eighth and ninth steps of BFHI. The eighth step is to encourage the breastfeeding on demand. Breastfeeding on demand means whenever the baby or the mother wants, with no restrictions on the length or the frequency of the feeds. And why? Because earlier passage of meconium, because of the lower maximal weight loss, breast milk, because breast milk flow established sooner, large volume of milk intake on day 3, and less incidence of the jaundice. And the ninth point is give no artificial pacifiers to breastfed infants. This is just to show the example of or the alternates of the breast milk, that is the artificial pacifiers, which we have studied in the previous slide, that they shouldn't be given to an infant. The last step of BFHI is foster the establishment of breastfeeding support groups and refer mothers to them or on discharge from the hospital clinic. The key to the breastfeeding practices is continued day-to-day support for the breastfeeding mother within her home and community. Okay, what do we understand from the word support for the breastfeeding mother? It's the postnatal checkup, home visits, telephone calls, community services, which includes outpatient breastfeeding clinics, and mere the counseling programs. Also, it includes, beside them, mother support groups, which help set new groups, which establish working relationships with those already in the existence, and and obviously the family support system. As you can see, the new norms of infants and young child feeding, they have replaces the previous policies or practices, which consist of exclusive breastfeeding for the first 6 months, introduction of the complementary foods at 6 months, which is also known as weaning, and continuing the breastfeeding up to the age of 2 years. Okay, one point which needs to be discussed in the previous slide is the exclusive breastfeeding. What do we understand from that is that the feeding of an infant, the exclusive breastfeeding is the feeding of an infant or the young child with breast milk directly from the female human breast rather than from a baby bottle or other container. As With respect to this it strongly emphasizes on the breastfeeding, because breastfeeding have enormous benefits. It have benefits to the baby, it has benefits to the mother. How it benefits the baby is that it's a perfect nutrition for the baby. It is also responsible for the higher IQ level of the baby. It's also responsible for the prevention from diseases, chronic diseases. It's a complete food for the first 6 months. It's for the emotional bonding. It prevents the infections. It's easily digested, and benefits to the mother includes the reduced post-delivery bleeding and anemia. It helps the delay next pregnancy. It's a protective against breast and ovarian cancers. It helps to lose the weight, and it's also necessary for the emotional bonding, and it needs no preparation. Okay, lecture has ended, but to add some more points, which you should know is that in a clinical setup, you may come across a term called "not enough milk," which is a most common complaint of new mothers. As a doctor, you should know that it's not true. It's just a perception. What you have to do is that you have to reinforce mothers. You should set them to have self confidence, and they should ensure frequent and effective suckling. As this breast milk is a complete nutrition, it consists of fat, which is 4%, carbohydrates, which is 7%, and regarding the benefits we have discussed earlier, but more adding more to them is that they save the resources, they are less waste, no refrigeration, no manufacturing, no bottle scans, no trucking, no handling. Hence, it is a heaven. So, that's the end to my lecture. And if you have any question, you can ask me.